So, hey to everybody. Welcome to the Diastasis Project. It's the Instagram Live with Trista Zinn, and it is being shown live on Facebook at the Diastasis Project. That's over here on my left, and I've got a camera set up. I've got my phone set up. So hello to everybody who's joining us, and hello to you, Trista. We'll just give people a couple more minutes to join in.
Sure.
Hello, people, and tell us where you're from. I will be scrolling through and looking at everything. Thank you very much for joining us, Trista. For those who are joining us and who don't know who you are, can you tell us a little bit about yourself, please?
Sure. Well, I am a mother of two. I have a 20-year-old and a 15-year-old. I think that's permanent. I am a lover of all things outdoors and fitness. So I am personal training is my background. I'm not a physio. I've been in the personal training business, I don't know, for many, many years. I want to say 27 years, something like that, 26, 27 years. My area of specialty since 2012 has been the hypopressive technique. And now I solely see clients for hypopressive training. I see clients on a Monday through Thursday basis, either at the clinic or virtually. I've been seeing clients virtually since 2012. I teach workshops and I teach the courses to the fitness and health professionals. And I have a level 1 coming up this weekend, actually. And I'm also, I guess I should say, I'm the founder of Corset Fitness and Hypopressives Canada. I'm the director, and I sit on the board of directors for the International Hypopressive Council. Important pieces I should also add.
That's fantastic. So basically, you're a fellow educator, health and fitness professionals who are the participants in your courses. You teach hypopressive training, hypopressive technique to both the public and professionals.
Yes.
You've got a level 1 course coming up this weekend. Fantastic. And yeah, well, just a little bit about myself as well. I'm a physiotherapist. I work at the junction of women's health, musculoskeletal, ortho, as well as sports physio. And I love all things to do with pelvic health, to do with pain, chronic pain, and sports injuries and sports performance. It's really hard to keep on top of everything. One of the key things that I wanted to get right off the bat from today is that today is polite. Today is a discussion amongst two friends. Today is about the fact that both of us are educators, and I love the fact that you're educating health and fitness professionals. I want more health and fitness professionals to be out there educating other people. I don't think there's one right way. I think that more education is needed, and honestly, if we can help each other, I want to understand hypopressives a bit more. And if there's any way that I can help you, that's what I want to do, because honestly, the impact out into the world is far greater than if we try to just, hog our own little kingdoms and try.
Sure.
That's not how most people are helped. So that's why I'm talking with you, because I really do appreciate your experience and your consideration in how we discuss this topic. So thank you very much again for joining us. And we're going to be talking about how hypopressives can relate to diastasis. That's 100% what we will be talking about. But I think it's only fair if we start by saying, maybe we can talk about what hypopressives are. And if people have any questions, put it on the Facebook live or put it on the Instagram live. I will be looking down and looking sideways. So please don't think I'm being rude to Trista. Trista knows that I'm doing this and she's happy to do that because I'll be managing the social media. So Trista, do you want to just give us a brief rundown on what hypopressive exercise and training is and who you found this type of training helpful for?
So Hypopressives is a core restoration and maintenance program that's a postural and respiratory technique that I like to say trains the true function of the core, because I like to look at it more of the function of the core as opposed to core strength, so to speak. I like that language better for myself. And it's very much a full body approach to core and pelvic health. Instead of taking one segment at a time, we're addressing everything from head to toe to the fingertips and the impact everything has on the core as a unit. It is based on postures, like a series of postures and poses that in the beginning are static in nature, more symmetrical. As you advance, they become more asymmetrical and we start to add rotation, etc. And we do these specific postures and poses all the while we're incorporating this unique breathing technique. Some people like to call it, it's the apnea, it's a false inhale. Some refer to it as a vacuum breath. The vacuum breath, I will use that terminology as well, but sometimes it doesn't always fit right in my language a little bit, only because I find those who teach the vacuum breath in some instances cue it differently than we cue it. In the fitness industry or strength training, and they cue this vacuum breath, and I don't tend to cue it the same way. So I might refer to it as the vacuum breath, the apnea, or the false inhale, but just so you know, yeah.
Okay.
Oh, and who do I find it helps the most? Sorry.
Oh, yeah.
There you go. So
that's unfair.
Yeah. The majority of people that come to see me are those with pelvic floor dysfunction. They're the ones that are seeking me out for this specific technique because of their own personal need or guidance. They're looking for personal guidance in this area, or maybe they're a professional who would like to use this as a tool with their clients or their patients. However, it really started off as that years ago, and I think that had a lot to do with my own personal experience, and that's where my passion kind of shone through the most, because that was my personal journey, was with the pelvic health piece and pelvic organ prolapse. But it's very much also sought after by those who want to train the function of the core and reap the rewards of what the core can offer. And I think if we're talking about the core, we need to take into consideration the deepest part of something. That's what the term core refers to. And then if we're looking at this, we're like, okay, what actually is the function of the core responsible for? And I think we need to take a look at respiration, digestion, circulation, phonation. It's a support system for our internal organs. It helps maintain continence, both fecal and urinary. So there's many things that the core is responsible for. And I think that if we're looking at the core and we want to train it as a unit, then we start to see some positive maybe they come to me for pelvic health reasons, but they start to notice changes in other areas, because it can also help in these other areas if we're addressing the function of the core. Yeah, it's not just the traditional or ab workout that was known as the core in the fitness industry. I think that was a little, went in the wrong direction there.
That's okay. Like, I mean, I hold us physios, particularly myself, because I was teaching it, the whole focus on transversus and breathing, the pelvic floor, and sometimes we miss it. So okay, it's like life. Almost like life is happening.
Yeah.
Oh, I forgot to mention that I've got a nearly 19, a nearly 18-year-old, and a 15-year-old as well. So very similar in ages.
Yeah.
We survived so far.
Yes, exactly.
So yeah, people with pelvic floor dysfunction. Something you said was interesting to me, and that we talk about language. The true function of the core, to me, what you just described with all the different things that it has to do, respiration, continence, managing your bladder, your bowel, sexual function, stability, all the rest of it. So you're saying the true function of the core is coordination, as opposed to just bracing and being able to work hard
Yeah, like I just like to see it as more than the abdominal centric based exercises that in my world, in the fitness industry, and certainly years ago, that was the core. And when I teach my workshops to the general public, and I usually ask them, so, oh, a friend of yours invites you to, oh, let's go to a core class, or my trainer's going to give us a core workout today. What kind of exercises do you think are going to happen in that session? Predominantly, the answer is abs. It's going to be abs, maybe the back. But there's not a lot of emphasis around respiration, what the breathing is like, what maybe some movement patterns are like, et cetera. So when I say true function, I guess it's my way of trying to break away from that whole idea of abdominal centric based exercises as the core, and taking a look deeper and taking into consideration what the term core even refers to. So that's where I'm going with that.
Sure. So I suppose not just abs is a good.
Not just abs. Yeah. Yeah.
But
abs are involved, but it's not just abs, and it's not just about the image you see in the mirror.
Yeah, it's not just about the flex and the pose.
Yeah.
So what is the core then for you?
So the core for me, when I look at it and simplify, I look at the respiratory diaphragm, I look at the transverse abdominals, the pelvic floor, and the multifidus, like basically that canister. But I think we can't just look at that canister. We can't look at one piece at a time because they're supposed to function as a unit, right? A lot of times in an anticipatory way or an automatic way. But again, everything from, like I said, head to toe into the fingers can affect its ability to function. So if a client comes to me and they come to me with a symptom that they're not happy with, then I like to take a look at sort of the big picture approach, not just zone in on what that symptom is and take a look at that specific symptom, but we need to step back and say, okay, wait a minute. How are you standing? How are you breathing? And take a big picture approach. And it involves a lot. I think it doesn't only involve a big picture approach from the body itself, but really listening to how they are dealing with these symptoms from an emotional standpoint as well. And I think that also plays an important role, and plays an important role with how they're breathing. Because if you have stress or you're anxious, or I think you kind of go into a bit of a protective pattern, you're not going to necessarily be breathing so optimally. But again, it depends on the person, and what might be optimal breathing for one person might not be someone else. But I'm kind of going with the fact that they came to me with a symptom. So let's take a look and see what might be the missing pieces to this puzzle, or put this puzzle together that can help improve this symptom.
Cool. So, so if I was to summarize then, not just focusing on the area of the symptom, but looking at a whole bunch of other things as well, trying to be as holistic as possible.
Yes.
And I suppose, so my bias, I'm a physio and I've done this for a long time now. So what I heard was, and correct me if I'm wrong, posture, alignment, breathing, coordination. How important are these things to you then?
They're important to me because I think they're important to the client. And I think there's not a one size fit all. There's not a cookie cutter approach to what this is. Because if I have someone who's in the course and I might say, one might say that your alignment is not optimal, but hey, you don't have a symptom. So who am I to say that that's not optimal for you? Because you didn't come to me with a symptom. You're symptom free. You can move fine. You're going through everything correctly. I am not going to make a comment on it. What is working for you is working for you. Someone else might come to me with a symptom for whatever reason. And that's when I'm going to start to be like, okay, wait, let's see what's going on and try to figure it out based on that person's perspective and that person's symptoms. So it varies from one to the next.
Yeah, and you know, you've been on one of my courses. I summarize that as figure out what the person does and then do something different for the result that they want, you know, as opposed to they're in the wrong posture. You said that they're doing everything correctly. Do you want to just explain what that means? You know,
I just mean that they're able to perform the activities that they want to perform, whether it's sports, hanging out with the kids, and they're able to go through these movements and nothing's bothering them. They don't have shoulder problems, pelvic floor problems. They seem to be performing everything correctly. So in their mind, like everything's good. It's good. They didn't come to me with symptoms. So live and let live a little bit until they, you know, until maybe something comes up. If they wanted to ask me a question based on something that I see, I'm not a pelvic health physio, as you know. I do think it's great for one to get assessed. I kind of think it's kind of like treat it like an annual and sort of get an idea of maybe tone, lack thereof, what the function is, just so you sort of know what the base is. For preventative reasons also, you know, but other than that, I think that if things are fine, I'm not going to start to say you should be doing it this way, not that way. That's going to throw the whole piece out of whack.
Yeah, so when you say correctly, it's not because there's a right way to do it. What you're saying is that, hey, it's correct for you in that everything seems to be going well and, you know, you're not having symptoms, you're able to do what you want. And, you know, the only reason why I say it is because the word correct to me means that there's an incorrect way to do it. And, you know, yeah, and I see some.
I know, and I know the word optimal is not good for you either. So I'm like, well, whatever is the best for you, or whatever, you know, is where I'm going with this. Yeah.
And I think that it's important because, you know, when you say a word, it means something to me. And why I keep asking you about it is not because I think you're wrong. It's just that I need to know what you mean when you say it, because otherwise I walk away with, oh my God, Trista uses the word optimal and correct and incorrect. Do you know what I mean? And so that's why I keep trying to understand. And so for you, they're doing it correctly doesn't mean that they've followed the textbook procedure. It means more that, hey, you're living life in the way that you want to, doing the things that you want to. Why rock the boat? And if you are learning poses that do bring on symptoms, it doesn't mean that you're necessarily doing it wrong. We're just going to have to do it differently, or there's different modifications for you. That's really helpful. And to me, just so that you know, optimal depends on what it means for you too. And to me, you know, there is optimal performance for people, but what it looks like is different, you know, like Usain Bolt and Michael Phelps, kyphosis, scoliosis, you know, there's so many people in the sporting world who reach the very pinnacle with what we would say non-optimal biomechanics. You know, and it's like,
and so I think what we need to look at is what's optimal for that person.
Yeah.
But it's not a big picture, global optimal that's for everybody, but it's for that individual, what's optimal for them.
Yeah, it's really interesting, you know, because we would get, sorry, I just hit the stand there. We would get referral bias, where what that means to me is that I see a bunch of people who lift and squat and lunge and load up heavy and go fast and all the rest of it. And I see these people because usually there's either something wrong or they can't get faster, lift heavier. That's what I love doing. And but I don't see all the people who have no problems with all of that, you know, like there's a whole bunch of people out there who are getting faster and stronger and all the rest of it. And so we tend to see the people that come in, and one of my referral biases is seeing people who are built asymmetrically trying to say squat symmetrically, and they've got knee pain, hip pain, back pain, pelvic pain, whatever. And it's like, nah, you're not built symmetrically. How about we try an asymmetrical squat stance? And suddenly things change for them. And to me, that's not because they did it wrong before. It's just different to what they did before. So
Yeah.
I'm really enjoying hearing what you think about certain things. And you know, our chat from, it was 2018, right? So our chat,
Yeah, I don't know how long it was.
it was 17 or 18. Yeah, you know, I still remember that. So for those who are watching and listening, feel free to drop your questions in. I am checking, leave any comments, and our discussion, Trista's discussion with me, I'll be sure to put in the project, and I'll try to post it on Instagram Live as well. It is on YouTube, the Diastasis Project YouTube channel. So getting to diastasis, Trista.
Yes.
Tell me, you know, lots of people, lots of people think about diastasis and the link to the pelvic floor. And one of the things I want to talk about later is some of the claims that are made, not just by hypopressive trainers, but all trainers and all physios as well. There's all sorts of claims being made out there. That's a different topic. Tell me how you think hypopressives works in diastasis and pelvic floor dysfunction. You know, you've been doing it for 9 years now. It's probably part, you've alluded to how it might have related to your own situation as well. You want to tell us a bit more about diastasis, hypopressive training, and even incontinence pelvic organ prolapse?
Okay, so first of all, I'd like to start by saying, I'm not, or we're not claiming that this is the answer for everybody. It's a tool that one is using either personally or professionally, or has in their toolbox for that person who might benefit from it. And I think one reason why we like to have professionals in the course who are going to be working with their patients and clientele is because they have that professional approach based on their background, and they know who their client is and what approach is going to be the best for that client. With regards to the pelvic health piece and what's happening there, I think there's a number of different factors that can affect the pelvic floor and why they're coming to me and why Hypopressives is working for that person. I think one of the pieces is the pressure management, that they're able to better manage the increases in pressure that are placed upon the pelvic floor after they've been practicing the Hypopressives. So they're not getting that constant pressure on the pelvic floor, which is helping. I think with what makes Hypopressives more unique than some of the other approaches, or makes it a little bit different, because we can get some similar outcomes to some other approaches as well. The difference being is that with this apnea or false inhale, we do get a decongestion of the pelvic cavity, which is a bit more unique, where we do get the organs drawn inwards and upwards. And we see this in the ultrasound. We can see it externally. Those doing pelvic health physio work can see it on internal examination, that the organs get drawn inwards and upwards. It's not like this. Not everybody's responds the first time they do the apnea. It's like, oh my God, it went up. Sometimes we do get a response like that, where it's like I just felt a shift, or something just, happened. But then it doesn't always stay there, right off the bat. It starts to go down, and then you have to practice, and eventually it stays up. And I think what happens, or I don't think what happens is, so we're improving the support system from the bottom up. Yeah. But we're also then enabling them to better manage the pressures that are placed upon things from a top-down perspective. So then, because they're better able to manage that pressure, they're not going to keep getting the pressure going to that area that's showing symptoms, whether it's the bladder or the uterus, etc. So it's very much a maintenance program. I also want to make sure that everybody understands this, because again, it's not something you practice for 12 weeks like you're doing bicep curls and you think you're going to be strong for the rest of your life. Yeah, it's a maintenance program. So yeah, if you practice Hypopressives and your results are, your symptoms are improved, etc., and then you stop doing Hypopressives and you go to do the activities that you wanted to do, yep, eventually probably you're going to get the symptoms back again, right? So we're using it to help manage, balance and counterbalance those pressures that are created throughout the abdominal cavity towards the pelvic floor. So which helps prevent the symptoms of heaviness, etc. We can help offer support from the bottom up, right? With the muscles, with the function that we're getting there, what's happening with that abdominal vacuum maneuver and the poses. And then the other thing that's also happening is when we do this abdominal vacuum maneuver, we get a deep sort of myofascial release happening, a release of tension in certain areas, and we're gaining a little bit more of a balance internally. And so the perspective of the RMTs who have taken the courses, the osteos who have taken the courses, even the pelvic health physios who can do a lot of work on the external piece or even internally, vaginally, the hypopressives helps to sort of maintain the results that they were able to achieve, or helps to complement what they're able to achieve with the techniques that they're using. So it very much is a complement to these other techniques that are used, the same way with diastasis. I think when we're looking at the pressure management and we're looking at what's happening there with the organs, again, we can't just rely on this abdominal vacuum maneuver. Many, many years ago, my understanding is when Marcel Coffier first started coming up with this abdominal vacuum maneuver, it was more in prone line in a clinical setting. And yeah, the women would get results. They, you know, things would get drawn up and it would feel good. They'd be relieved of symptoms. But then if their daily activities and tasks weren't so optimal for them, then they might start to show symptoms again because they weren't looking at everything from a big picture. And maybe the way they were carrying the baby wasn't optimal for their management of pressures, et cetera. So then it became more of a full body approach and a technique that's offered as women that they can use as a tool themselves, or men, as a tool themselves at home to help better manage the pressures, to help maintain the results of what's happening with abdominal vacuum maneuver. And there are a series of these postures and poses that are done. With regards to the diastasis, again, we're not saying that we help everybody, and I think we really, with the diastasis, there's so many different factors that are involved. And I think there's a lot of many reasons why women come to you with the diastasis, or they want the help for the diastasis, is for the aesthetics, probably more so than actually what's happening within that, the linea alba and the separation, et cetera. I think posture helps a lot with that, or posture alignment to optimize things, because well, just even if I gave like a little bit of an example, so if you had a zipper and this was the rectus abdominals, and if they're more in a position where things are pushing outwards, but then we can help to improve and have things drawn inwards and improve this, decrease the waistline and improve the tone, or the resting tone of the abdominals, then we're kind of bringing everything inwards and upwards. I think that there's not inwards and upwards. We're realigning things, the rectus abdominals, we're sort of bringing the borders together. It's not just about bringing them together, but we're also trying to see what the function is like of the linea alba, or what the tone or lack thereof is. And it really depends on one person or the other who responds to it. And I think also, again, it's not just about the abdominal vacuum maneuver, which seems to be the eye candy of social media. It really relies also on the postures and the posements, and adding more load. It's not just about the static symmetrical postures. When we have some with diastasis, we really want to start taking a look at the asymmetry of the poses, starting to add rotation. There's different poses where you're far more loaded, whether you're on all fours, you're bringing yourself up, you're going into a lunge, a step forward, and then we're anyway adding rotation and movements this way. So we're trying to do the best that we can to help that person the best we can with the diastasis. And a lot of them are very pleased with the decrease in waistline. their improvement there, and they're feeling like they've now got a better support system than they had before. So when they're going to do the activities that they want, they feel more confident within those activities because we've improved that support system.
Okay.
So there you go. Go.
There's a lot there, Trista. There's a lot there. Okay, so first of all, I think you mentioned something about organs up and in, supporting from down below, as well as using negative pressure to change the position of the organs. And again, just to reiterate in general that nobody is making a claim that this solves all problems or that it's the only way. So I just want to reinforce that, that you said that. And I'm not putting words in your mouth, right? So, so, you know, that happens. And what's interesting to me when you said that is that we see people with prolapses that didn't even know that they had prolapse with no symptoms. And even like outside the vagina, like that's the only reason why they know is because they can see it or feel it there. But otherwise they don't feel heaviness. They don't feel other symptoms. And yet there are other people with, we might say, a stage 1 or a mild stage 2.
We're very symptomatic.
Very symptomatic. So it makes me wonder if the change in the position of the organs that is seen on ultrasound or examination, I'm wondering if that's just a change in, because it might be a sensitive system, something that's quite aware of that. And changing that might change the autonomic nervous system or just the whole coordination of that nervous system. That's interesting. Number 2, you said that for some people that position will change and stay. You did reiterate
with maintenance.
Yeah, you did reiterate that it is a program. So that means that it's not like it's a one and done.
No.
You mentioned, you know, posture, alignment. To me, what that means is that doing something different to what they prefer to do most of the time. You mentioned pressure with carrying the baby. It's interesting because there was a study done, well, probably a similar study done at the same place, a few studies done, but they looked at carrying baby carriers and things like that. And I was talking to the researchers, and you know, the ideal way might be ideal for different reasons to what they thought to what we do. The bottom line is that we can't avoid pressure in our lives. And I've seen people with... It's
everywhere. You can't stand up from a chair, you can't walk, you can't do anything without, we're on a planet with gravity. So we're just...
Right. And so, you know, unless you're doing negative pressure exercises like hypopressives for a long time of the day, can we actually overcome physically that type of creep loading? That's what's going through my head. As well as, because I'm not disputing, by the way, I forgot to say this at the start, I am not disputing that you and hundreds, thousands of others are helping people around the world. The results are not in dispute for me. What we're talking about is the reasons why the results might be there. If you tell me that, you know, you saw 1,000 people and 1,000 people feel better, I'm not going to say, no, they didn't. I'm just going to believe you. So we're talking about why. That sustained loading, that sustained pressure, that sustained, you know, stretch almost is, you know, can it be countered by 15 minutes, 30 minutes, 60 minutes of exercise a day? Now, if you're seeing results, I'm wondering if that's a neurological system adaptation. I'm wondering if, you see, because we like to do things in a certain way for lots of different things. You know, there's a lifting technique that people get taught. There's a hypopressive technique. There's gymnastics technique. There's even manual therapy technique if you're a physio, you know, like when you learn massage therapy, there's a certain way to learn how to effleurage and all the rest of it. I wonder if part of the, wow, my phone turned itself off. Sorry about that, people. You know, I'm wondering if the discipline of doing things to a certain standard as opposed to the standard itself is helpful, because I've seen people hold to things that I just think are ridiculous. And I'm not talking about hypopressives, I'm just talking about random things, right?
Mhm.
These people are doing okay, and it's almost like the act of holding to a standard is restorative for them, not necessarily the physical things that they're doing to hold that standard. Do you know what I mean? So I'm wondering.
I'm trying to wrap my head around what you mean. I'm trying to wrap my head around what you mean.
Well, let me get specific, because I have tried Hypopressives.
Okay.
It's been a few years, so I'd like to try it again. But of course, I've been stuck here.
I've got a spot in my course this weekend, virtual. You should attend.
I would love to attend, Trista. I can't, unfortunately. But well, minus the fact that it's like stupid o'clock in the middle of the night for me.
Yes.
Unless you started at 8 p.m. your time, Eastern, it's probably not going to happen. So, you know, these, you know, the positions, it's very particular. I've got to have my hands a certain way, and no, it's not quite right there. No, it's not quite right here. Move your ribs here, head here. That to me is holding to a standard. I don't have a problem with that. I only have a problem if people say you're doing it wrong. If you say, hey, you're not doing it the way that we were taught that we have to teach it, I think that's different. But if you say, no, you're doing it wrong, if you don't do it right, you're not going to get, you know, whatever benefits or whatever, I think that's a bit harsh. So holding to a standard I don't have a problem with is what I'm trying to say. I'm wondering if the restorative effect comes because we're trying to hold to a standard. Do you know what I mean? Like, I have a standard for strict pull-ups. I don't know if you remember it. We didn't really do pull-ups on the course that you're on.
No.
But I don't like people to arch their back. Why? Because it's a lot harder to not arch your back. I don't like people crossing their legs. Why? It's not because it's wrong. It's just harder to not cross your legs. I like people to point their toes and hold a hollow position. Not because it's better, it's just harder. So if you're going to do something, do the hardest version possible, because then when it comes time to do everyday life and you just have to pull yourself up, it doesn't matter what your technique is because you've done the hardest version of the technique before. Sometimes that to me could be the restorative part of it, you know, as opposed to, oh, we only got results because they stuck to this method and I was on them, any sort of deviation. Anyway, these are just some of the thoughts that are coming. And the diastasis, you know, the bringing in. Sorry, I didn't mean to cut.
Yeah, so I'm just gonna interject there just a little bit. A lot of what I do and what I do with my clients is I like to ask them too what they're feeling and what the difference feels like from being in one, whether you're having your feet this way versus having them another way, having the fingers here versus having them here. Okay, what enables you to breathe? Oh, okay, this is good. Okay, so perfect, let's do this. I had a client today, she can't have her hands like this in the guy position. I'm not gonna have her be in grief because her hands are like this. I'm gonna modify and say, okay, so what's more important for you in this position? This would be more important for you because I think here you're gonna be able to breathe with ease. And the postures and the poses, one of the things that I like to say is, if you can't breathe with ease, something's a little off. But then don't go to do a major change and come out of it and go to do it again. Just fine tune it, just a little tweak here. There's a, okay, now I can breathe, now I can move. Then that's good for that person. To say, so I always like to show if I can and have them let me know, okay, is this okay? How does this feel? I'm going to ask you, what happens if we tuck the tail in a teeny little bit if you had a tail? Can we just see what happens? I might be wrong. I might be right, but I want you to let me know. I always say this, because I don't know 100%. I need to like move them a little bit and they're a little different, but I always want them to give me their feedback because their body's their body. It's not mine. So I always want the communication to be open with my clients so they have the freedom to say like, oh, it kind of bothers me doing, okay, then can we modify it? How about like this? Let's talk about why this is. Maybe as part of the process, I want them to understand why. So then they're like, okay, oh, it's part of the process. I'm doing it right. This is what it's supposed to feel like. And then they can move forward confidently. I think definitely there's if I'm understanding correctly, I think where you're going with, and I could be wrong, with the, what did you say, that there's like a system that they're following, or there's a
Handed to hold.
Yeah. Like they're doing this technique. They're like, okay, this is the technique. This is how it's supposed to be done. I'm going to get results, etc. I definitely think that there's a factor that's affected, or how am I wording this? I think it's important. I feel it's important that if the client is coming to me and they want to try hypopressives, I think it's a good idea if they believe in the system that they're approaching, because I think that you can do anything. If you think it's stupid or it's not going to do anything, you're probably not going to get that great of results. But if you're like, okay, oh, can you breathe? How does it feel to be there and grow? And there's a big mindfulness component to this. There's a big getting to know yourself component to this. There's a big mental and physical journey to this, which improves your, I want to throw the word out, proprioceptive out there, but I don't know if that's going to be a term that you're not happy with, or language. But you kind of get to know your body from the fingertips to the head, your head placement, to everything, what it feels like to breathe again, what it feels like to breathe with ease, what it feels to feel good. And I think if we can free up the breath and we can allow them to, allow themselves to breathe, you are going to change so many things just from an emotional standpoint. And then the whole body's like, oh my God, thank you. Now I can breathe. Now I can move. Now I don't have to be thinking always of my symptoms of the pelvic floor. Let's take them away from there. And I think with the regards to the symptoms that you feel, and like you say, one person can have a stage 1, if you will, let's just say, call it a stage 1, be very symptomatic, where someone else could, like you say, the bladder can be external. They didn't know, they just push it up every time they're in the shower in the morning. Some of the women that I've seen, more of the older women that I see, I suppose, have been like this. They're like, I didn't even really know I could do anything about it, but I hear I can do something about it. So I'm curious to know what are my options and what I could do. And I think that changes. And I think with regards to the nervous system, what happens, where there might be tension in the body, where if we can relieve some of that tension, we're not necessarily saying you need to bring a 2 up to a 1 to no prolapse at all. But if we can have that 2, if it shifts in whatever way, however little it does, but that person is now symptom free and is able to then go through with an enjoyed quality of life, and they don't have to be thinking about this all the time, that's an improvement. That's a change. And I think really that's what we're looking at. I try to have my clients not focus so much on the numbers. How are you feeling today? And then I just had a client who's come to me and she's telling me, well, I've only seen her twice now. And she's like, well, I'm able to get through a good part of the day and I don't have symptoms, but in the evening I have symptoms again, or I have like, okay, let's focus on all those things that you can do that you're now symptom free. Let's dedicate some time and energy to those times in your day, not always focusing on those times that you have symptoms, right? And let's start to see what other things are starting to happen. Well, I did notice that my bowel movements are better. Okay, that's awesome. It's just like little things that are starting to change. Let's focus on these things instead of dwelling on these little things. Then we're making change, both emotionally, physically, and improving a quality of life. And I think really that's what we're looking for, even with regards, and I don't have as much experience with diastasis, I'll let you know. I don't have a lot of clients coming to me specifically for this reason. So I can't like delve into that, with a great deal of energy, I suppose. But I do know that those who have come to me with diastasis are not comfortable with their body. They feel insecure doing the workouts that they're doing because they feel that they don't have the support system. They're worried that they're going to injure themselves, not just along where the diastasis is, but their back or something else is going to go. They've read, I guess, literature that's told them, or maybe someone has said like, oh, if you have this, you shouldn't be doing X, Y, Z. And I think what they want is they want some positive feedback from someone who's going to say, hey, you know what? You can do these tasks. Let's see. And I think, I believe, and I think that with anything, you progress. And I might not be throwing 20-pound, dumbbell. Okay, let's progress. Let's start you off here. You haven't done weightlifting in a very long time, or you want to start getting into it. I'd rather err on the side of caution a little bit and progress you. Okay, how are things going? Yes. Oh, it's pretty good. Okay, let's move up from here. As opposed to going, heavier, then starting to knock things off. So this is my approach. And I think, like I said, connecting with the client from a personal perspective at the beginning, that conversation you have with them at the beginning is key. And I think when I teach the courses, I do have part of my course, I do like to cover this with regards to the approach that you have with the clients and the tone of voice that you use. And it's the tone of voice and it's the body language that you use. And I think it's really important. I think it's really, really important. And if it's an athlete who's coming to me and they're just want to do a different type of training for their core, my body language and my tone of voice might be different than someone who is just crying with me for 20 minutes in the room, or it's really important, or the senior who needs the extra time and the extra care and the extra patience involved, and to be really with that person. And I never promise my clients anything. I never promise they're going to get, oh my God, it's going to go away, you're going to be better. I can offer them one promise, and that is that I will give them the best that I can give them, to try to help them the best that I can with the tool that I'm offering them, which is the Hypopressives, which is why they came to me. And I work with them with that tool the best that I can. And I want the communication to be open with that client, so I can guide them the best that I can for what feels good in their body and for that person. And I think when you're talking about postures and poses and specifics, again, there are specific postures and poses that we use, but there's many modifications that we can use. And there's many, okay, let's use the wall instead of being loaded. Oh, let's get you to feel what it feels like against the wall, because your perception of where you are in relation to the wall is very different than what your perception is to being on the ground and being very loaded this way. So let's make you feel comfortable in this pose using the wall. And then let's see if we can bring you down to the floor and this. And I'm kind of going off on a tangent here, but even I could have someone here's another person who came to me who was very insecure. She walked in the room. She was a young mom. She looked like she was healthy and fit. She came in. She was so not comfortable with her state of instability in her sacrum and her spine. Like, just to have her come to the wall, a support system, and to have her breathe here, she was going to pass out. Like, I had to bring her to in the studio, we have the reformers. So I brought her there. I had to start with her in a very, very different space. I had to make her feel very comfortable. It was very gradual. By the end of seeing her, she was able to do all the poses. With her, I couldn't start with her on her back. A lot of people, I start with them on the back. For them, it's the least challenging, posturally challenging pose. For her, I had to start with her sitting, where she felt comfortable. Can you breathe here? How does it feel? Kind of like it was little steps. So although we have these postures and the poses, I want you to understand that they're modifiable. We change them depending on the person's needs, their abilities based on their body. Whether we need to use a prop like the wall or the table or something, but there are specifics to the poses that we try to adhere to, for sure. They're there for a reason. It is a workout. It is an exercise technique. So we try not to bolster, and it's not like, just relaxing and just breathing to be there. There is an intensity to it. It's an exercise program, and we are stimulating things. It's not just a rest and digest program. Anyway, sorry, I went off on a tangent, but I'm trying to get you to understand like what this is about and what the technique involves a little bit, and that it's not just a cookie cutter specific, and that it involves far more than just what we see in the body itself, but the nervous system, this whole piece. Anyway, sorry. Cool.
That's okay. You're obviously very passionate about it, and I love that about you, Trista. If I could just recap, hopefully, and you know, just let me know if I don't do well. Let's start with the postures and the standard, and you know, the certain way that you teach the technique. You said it's there for a reason. We're almost out of time. You know, I'd love to hear more, but what I wanted to hear, what I got from it is that, hey, you know, this is how I interpret it in my head. Hey, we've helped a lot of people, and it seems like when we start off at this position, we seem to help lots of people in general right off the bat. And then from there, from this starting point, we can start tweaking it, because some people can't get into that pose. And what's more important for us, and when I say us, I mean you as the trainer, is that, hey, you know, your ease of breathing is more important to me than you hitting a textbook posture that I could take a photo of for Instagram, right? So I'm hearing that how it feels for the person is more important. I'm hearing that you're taking into account that it's a journey. You use the word journey, and you know, that's why it's a program, it's a maintenance thing. It's and that's a bit of what I went to with the discipline of holding to a standard. That standard would also be that maintenance is assumed that you're going to do that. And that could be part of the helpful part of it as well. You mentioned that it's an exercise. I really love that you mentioned that, hey, if somebody's coming to me for it, you got to at least start off by thinking this is going to be helpful, because that is really powerful. And you know, Tio has mentioned that on Facebook, that bias is just so powerful, you know. So that, I thought that was really cool to hear you say. You know, the posture, the alignment, like all of these things, we know individually it might be different, but then if you're making it an exercise, just like I said, a hollow hold, toes pointed, feet together, you know, maintaining the position of your spine while you do a strict pull-up, to me, that's the hardest way to do a strict pull-up. That's something that you can work towards. It doesn't mean that you're not doing a pull-up right. It's like, great, you did it that way. Now, let's make it a little bit harder. And I hear that in what you're saying. Hey, yeah, fine. Instead of internally rotated in whatever position that you think is the one to aim for, because it's going to be difficult for a lot of people. You know, you might have to start here. And like you said with that lady who had trouble breathing, we're starting here. And then you said, little by little, we work towards that. You see, I think we work the same way that way. And that what you're describing is being an awesome coach, right? An awesome coach. And that's, as a health professional, I'm a coach. As a fitness professional, you're a coach. And all of us as parents, we are coaches. I forget that sometimes, because, you know, you default to what you learned instead of the hard stuff. I do want to just ask two quick questions, if you could have two quick answers for me. So what timeframes would you, this is from Christina Ann, what time frames would you consider before introducing hypopressives post-op or post-C-section?
It depends on the person. Like I say, usually when they're given clearance to exercise, then we can start introducing things. However, that I do have someone post C-section or post-surgery, there's always things that I can introduce, because I think the breath work is so important. I think that if you're in discomfort, you're going to get into a protective holding pattern where possibly you're not going to be breathing so well. So even if I can get them to think of simply, okay, wait a minute, how am I breathing? Just to inhale, okay, can I stand up and can I breathe here? Those little things I think are just stepping stones to being able to start thinking about the hypopressives. And it depends on if the person's seen me in the past before, if they already know some or have some of those tools in place. But it's kind of like, okay, wait a minute. Can I stand up, and instead of being in this hunched over position to walk to the bathroom, can I be here to inhale? Okay, I got it. And then carry on and walk. So I think we can gradually start this way. Then we start to, if they start to feel comfortable within being in the poses or the postures, I think it's that apnea breath or that false inhale where we have to really take this into consideration based on what surgery they've had, what they're able to do when they have clearance to exercise. Obviously, the suture, whatever, has to be healed. We're not going to introduce this to something that still has stitches in it or isn't healed correctly. So we need to make sure all of this is healed, and then we can go. But there's little steps that they can start to take 100%. That will lead them into the hypopressive technique and will help them with all the postures and the poses going forward.
Yeah. So what I'm hearing you say is people have to breathe. People are already breathing. So if you are already breathing and you are listening or watching this discussion with Trista, you're breathing correctly, okay? You are breathing correctly because you haven't passed out. Hypopressive training has different styles of breathing that you may not have done. And so we can start that breathing. I agree with you. We can start that breathing training on day one. You know why I know? It's because that's what I was taught to do. I was taught as a student to go around all the different wards and help people laterally basal expand, get a 3D breath, basically.
Yes.
Like this was nearly 30 years ago that I learned how to do this in my undergrad. I'm just watching the time. And so, yes, we can start. Basically, we can start things. And if we look at their everyday life and what they're doing in their everyday life, some of the hypopressive exercises that I did are not necessarily harder than, getting up out of a low chair, picking something up out of a cupboard, getting dressed. Like, some of these things are a lot harder than maybe just sitting and being mindful, and some of the breathing that I'm sure is included as part of your training.
Yeah, like I said, there is a bit of an intensity to the poses to be able to inhale and maintain, and can you breathe there and maintain?
Of
course. With regards to the breathing and the lateral breathing, we very much respect the fact, understand, and know that the breath is three-dimensional. And with this exercise technique, we focus a little more on the lateral breath, but day-to-day activity, we're looking at a three-dimensional breath. It's not here, all day that we're thinking that this is how the ribs are supposed to move. Yeah.
No, I never, actually, I just realized that that's an assumption that I had about hypopressives, that I don't think of it as one-dimensional. To me, it's three-dimensional.
100%.
And honestly, the focus that physios have on lateral basal expansion, and it sounds like you have on encouraging that lateral movement. Honestly, I think it's because we just see lots of people are missing that part of their breathing mechanics. Not because it's wrong, it's just because that's how people behave when they're in pain. And it takes encouragement to help expand the rib cage. And what I hear from you is gentle encouragement, safe encouragement, working within the parameters that the surgeon has provided, the doctors have provided. And you can start in bed. I'm going to guess that there are breathing exercises that you could do lying down, but if you're doing the exercise part of it, that there is a certain intensity that you have to be ready for. And honestly, it's the same as when I give people, a really hard exercise program versus, hey, this is something you can do when you're lying down before you go to sleep. You know what I mean?
Yeah, or when you're
all the levels. And I don't think that I'm special as a physio for that. And I don't think you're special as a hypopressive trainer for that. I think that we're, like you said, we're helping people with what we know how. And that's why I really enjoy this type of conversation. Maybe not lastly, because I don't want to finish on this, but the extraordinary claims that I've seen out there, the You know what I'm talking about, I think. There's been some outrageous stuff out there in the name of hypopressives, and I'm not blaming you, and I'm not making you defend them.
Mm-hmm.
When you see those things, what are you thinking about? And is it taken into consideration for what the average person seeking help, what are they thinking about when they hear things like that? And I'm talking about things like cure your prolapse and solve your incontinence and banish that pain and all of these things. What do we do about that?
I think what needs to happen is maybe the language needs to change a little bit about maybe what the person is, those who are promoting this technique. Maybe there needs to be a softer approach, perhaps. I think that if we offer them, we don't want to claim that it can, right, offer you this. And I think that I don't think it's only in the hypopressive world. I think it's in
100%
worlds, like
100%.
They're saying, oh, pelvic pain, we can help you. I don't know what these TikTok things are. This is how you do it, da da da. And you're like, okay, I think part of it's a sales. It's sales. They're trying to draw you in and sell you this technique and offer you maybe the hope, but maybe they're doing it in a way that's too, can I say, like car salesman-y instead of like
traditional sales and marketing, perhaps?
Yeah, and I think
it's difficult. It's a wrestle that I've had, Trista, because obviously I sell courses, there's so much stuff that I have. And to sell, I've got courses, I've got consults, I've got online stuff, I've got live stuff, you know what I mean? And part of the ethical and moral questioning that I have every day, like today I've got a big marketing day, like how much can I say that I'm okay with morally? How much can I say without crossing my own lines, without fear-mongering? How is it going to land with somebody? I don't want somebody to think, oh no, if I don't do this.
But it's mentally exhausting. It's exhausting. You don't want to get people to write a post. It's exhausting. So, what I try to do, and whether people think that it's doing this or not, I'm not sure. But if I try to do a video or something and I say hypopressives for incontinence, but then I like to write why it can help with incontinence, right? But it is something that it is a tool that's used that can help people with incontinence. But I'm not saying it's the only tool or it's the only thing out there. It is one thing. Yeah. Hypopressives for mindfulness. Okay, it does help people. Why? Because it offers you breathing, da 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 da. Why can it help with prolapse? But I think we have to start somewhere. We have to say something. Otherwise, what are we going to say? Hypopressives for prolapse, and then start talking about, I don't know, furniture or something. You have to start like,
I think you were right the first time when you said it, and Tio said something, it's not something that'll work for everyone, but definitely can try. You don't even have to do that in your marketing. I think it's like, hey, do you have prolapse? Do you have incontinence? Have you tried other things? This is another thing that you might want to try, or this is another thing that you can try.
For sure.
And these are what we think helps, and these is why we think it helps, as opposed to, some of the stuff that I've seen or I can tell you, I stopped looking for them, honestly, because it was just upsetting. And when I say this, it's like you said, it's not just hypopressives. Oh my goodness, it's everything. And it's physios as well as trainers, and then those who don't have any training at all as well.
Okay, so then that bugs me too, because still same. I'll see people doing hypopressives. I'm like, oh God, what are you even doing? Like, how are you even claiming this is? Where did you learn this stuff?
Yeah,
that you're saying? But I think you can do that with everything and anything. And I think, what was I was gonna say something. I don't remember what it was.
Let me just read out what Kim said. Kim Vopny, she said, in defense of the claims, it can improve prolapse, incontinence and pain. I agree with that for sure. And it also provides hope to people, which is so often missing, especially with prolapse and pain. And I agree, you know, there is, and as you've acknowledged so many times, Trista, it's not the only way. There are many things. And the last thing that I would want for somebody with prolapse, pain, incontinence is to think that there's nothing but surgery for me, because we do have evidence that lots of different things can help. And, you know, working with people in a team is one of the best ways we can do it.
100%. So can I just sum up like a little bit of something quickly too, with regards to that, is that Hypopressives is a tool that complements other training. So we have people who come and who combine even Kim's program, Fem Fusion's program, Lauren O'Haines, someone else is working with diastasis is doing the bar, barrel, some other, and they combine it with it. Sometimes it's a combination of two things that also give the results that they're looking for, whether they're using Hypopressives as a stepping stone or the final piece that kind of wraps things together. And that was their missing key. So I don't think it's the only thing. I don't think you have to only surrender to one. I think it's, like I said, it's a journey, and you feel what feels right for you in your body, what resonates with you, that you're able to like, oh, now this makes sense. This is what I'm going to feel. This is the approach. And I like to combine the two, or you move from one to the next. So it's not an exclusive exercise. And again, I just assume that it's not, right? So yeah, no, that's good. Kathy Watson has put a couple of comments there. I've had many clients that Hypopressives has helped with their incontinence. Sometimes women who have more difficulty connecting with their pelvic floor muscles do better with the indirect method of connecting. I have clients who have great success. The most important thing is that we have different options to help our clients. And I agree totally with that. A lot of what I do is try not to get to the direct cueing of muscles as much as possible. Once I know that they're working automatically, we just try to work with that. And, you know, I know with hypopressive exercise, that does happen, because as soon as you change pressure, as soon as you make something difficult, the pressure increases. Oh, that's what I was going to say before. When you said to increase the tone, narrow the diastasis, like increasing abdominal tone and narrowing a diastasis increases the pressure, which I think for some people would freak them out if they understood that. But it doesn't mean that their prolapse is going to get worse. In fact, a lot of people feel better. And it's improving the support system, not more so than the tone, but that support system is maybe the word I should have used instead of tone.
Or even if it's the tone, even if it's the muscular action, sometimes just feeling stronger helps people feel better, because when you have a bigger capacity, everyday life just becomes easier. You know, I shortcut it to saying, if you make your training harder than life becomes easier. If you can pick up 220 pounds,
you have to challenge it. So we're challenging you with these postures and poses, this unique breathing technique. And with Kathy's thing, we can also improve proprioception because of the pelvic floor, which is helpful because you feel, oh my God, everything going up, and you're like, oh, that's where the muscle is. That's what's happening. And then you're able to better voluntarily. Maybe, but not with everybody. But you can start to feel, the majority of people start to feel things rise. And if they had a disconnect before, then now they have a bit of a connect, right? Where they're able to feel what's happening.
Yeah, we're just trying to find the different that makes a difference for people, I think. And that's what I get strongly from what you've said today, which makes me happy, because that confirms my bias. It confirms what I teach. What I really loved about today, Trista, is that heard more about hypopressives. I can tell just by talking to you that compared to 3 years ago when we last chatted like this, there's a difference. There's a difference. And that makes me happy, because I hope that I too am different to 3 years ago. I know that I teach things differently to 3 years ago.
We have to evolve, we change.
Right. And if we start standing still, I've always said, if I think that I know it all now, then it's time for me to give up, because yeah, that's not a really healthy position to be in, thinking that you know everything. So really, thank you very much for this. Thank you for the interactions. For those of you who have watched all the way through, thank you very much for watching. It'll be available on Facebook. It'll be available on Instagram and YouTube. We will be working on answering any questions that you have. So please be sure to tag me and to tag Trista on Facebook or on Instagram if you have any questions at all. And Trista is, you know, as you've seen through this whole hour, Trista has been a really reasonable force, a really reasonable person in the world of hypopressives. And like, honestly, I really enjoyed our first encounter. I enjoyed having you on the course with me. I wish you all the best for your course this weekend. And, you know, would really love to catch up again. And thank you for answering the questions. You know, the bottom line for me with diastasis and hypopressives is it's something else that you can try. The bias that I have is that lots of people are lacking general strength, you know, like literally the ability to do sit-ups and leg lifts and all the strong coordination, long lever stuff. Like, I think lots of people probably just historically with managing diastasis are deconditioned. And what I'm hearing from you is that hypopressives is one way to do that. And you can combine other training with it. And, you know, if you find the right trainer who can work with you, and what I love is that you're not particularly dogmatic. You have to be, I know that you probably have to be a certain amount of dogmatism in terms of, well, we have to teach it this way so that there's a standard people know. I get that, right? I get that, and I'm not having a go at that. What I'm hearing from you is, as somebody who is a high-level trainer, what I'm hearing from you is, this is just my starting point. If you're going to start with hypopressives, use this as a starting point, and then work with the person to make it right for them where they are today, with a little bit of challenge, because it's a journey. It's not a one-stop, you know, fix everything in 6 weeks type thing. And yeah, I think that's extremely reasonable. And, you know, no extraordinary claims from you today. There's nothing weird about it. So, hey, and those of you who do see weird claims, be sure to just private message us, because, you know, it's always helpful for us to see what is out there. And we're not going to go attack anybody. We just want awareness, and, you know, it helps us change how we message as well. Because what I do with the negative stuff that I see is I go, well, what do I think about that? And then I can post something positive about that sort of thing. You know, I've given up with trying to start too many fights. Every now and then my medications. Oh, actually, that's what I was going to say. I have ADHD. I didn't know when I met up with you last time, but I have ADHD. I only got diagnosed about 18 months ago. No, hold on. Yeah, 18 months to 2 years ago. I got diagnosed, and I've been on medications for 18 months. And I wonder what hypopressives would be like now. I know that, you know, stretching, yoga's fun. I don't have a problem with yoga, but you know, my brain races. So I've
never been a yoga.
And there's nothing wrong with yoga. I think yoga is awesome. I think yoga is awesome. I think yoga is awesome. But I think, you know, you can choose for what's good for you.
But wait, you only have so much time in the day. One day I'm going to do yoga. Yoga looks awesome. I would like to try yoga. I just never gravitated there when I was younger. So this is where I'm at today.
And I do like that, you know, hypopressives is mindful, that it has standards that you're trying to reach towards, and it is active. And I wonder if that might be something that would be something, if I wanted to do that personally, for my flexibility and mobility and feeling good. I actually like lifting heavy weights, and that actually increases my flexibility and mobility So, you know, that's why it can't be a one size fits all. You know, I'm thinking of somebody who's got a bilateral avulsion in her pelvic floor, prolapse. They're talking about trying to sew the levator ani muscles back on her. She was leaking with running. She couldn't jump. She couldn't lift weights, her prolapse symptoms, all of this stuff. And she told me she wanted to start CrossFit, so I helped her do that. She is symptom free when she keeps up with the lifting heavy weights, and she's been internally checked and she's doing really well. So, yeah, you know, it's you got to find what works for you. And hypopressive sounds like, and it always has been for me, another thing that you can try because you're looking for the thing that works for you.
Yeah, 100%.
Beautiful.
Enjoy the journey. Enjoy the journey, right?
That's it, right?
Ups and downs. You got to enjoy the journey and go for the ride. And yeah.
That's it. Thank you very much for joining us. Please leave a comment, like, share, subscribe, all of the usual things. I'm going to stop the live feed now, and yeah, we'll catch you up. We'll catch up with all of you soon. Thank you.
Thanks.